Hello friends, in this video I'm going to discuss about Huntington's disease. Okay, so Huntington disease is a hyperkinetic movement disorder. We have discussed about Parkinson's disease, which is a hypokinetic movement disorder, but Huntington disease is a hyperkinetic movement disorder. Can you tell me what is the inheritance pattern of Huntington disease? It actually comes under trinucleotide repeat disorders. Trinucleotide repeat disorders usually they do not follow the Mendelian pattern of inheritance. However, the pedigree of Huntington disease resembles that of autosomal dominant. So that's why the inheritance of Huntington disease is autosomal dominant. They show autosomal dominant pattern of inheritance. It is also a trinucleotide repeat disorder. And what repeat we are going to get? We are going to get CAG repeats. CAG repeats. And these CAG repeats are present in Huntington gene. The gene is HTT Huntington, and the protein product is Huntington. Okay, protein product is Huntington. Here, because of the CAG expansion, there will be a toxic gain of function type of mutation. Toxic gain of function type of mutation, which will cause excessive Huntington protein production, and that will be neurotoxic. Okay, this involves the GABAergic neurons. This involves GABAergic neurons in the caudate and putamen. But predominantly it involves the caudate nucleus. Okay, so caudate and putamen both are part of basal ganglia, and the GABAergic neurons of the caudate and putamen are involved, and predominantly they involve the caudate nucleus. So basically, there will be decrease in GABA among the neurotransmitters, decrease in GABA and acetylcholine. However, there is increase in dopamine. In Parkinson's disease, there is decreased dopamine, and in Huntington's disease, there is increased dopamine but decreased GABA and acetylcholine. Okay, and one more point you can appreciate here, because of this caudate involvement, as you can see, because of this caudate lobe atrophy, there is compensatory enlargement of the ventricles, compensatory enlargement of the lateral and third ventricles. Okay, so this is also known as hydrocephalus ex vacuo. Hydrocephalus ex vacuo. Okay, so this also we have discussed in Alzheimer's disease because of this cortical atrophy. In Alzheimer's disease, it is because of the cortical atrophy, and in Huntington's disease, it is because of the caudate and putamen atrophy. Okay, so what are the clinical features we are going to get? Basically, it is characterized by chorea. Chorea is jerky, involuntary, or dystonic movements involving the limbs or face or any part of the body. So these are actually involuntary, semi-purposive movements. Apart from that, they can also have depression. Features of cortical involvement also they can have depression and dementia. Okay, so chorea, depression, dementia, anything they can have. Okay, and usually this disease manifests in the fourth to fifth decade, and usually they die within 15 years. Within 15 years, they die. And because it is a trinucleotide repeat disorder, they show the phenomenon of anticipation. So what do you mean by anticipation? Anticipation is with each successive generation, there is earlier onset of the disease and there is more severe disease. Okay, so with each successive generation, the number of trinucleotide repeats will increase, and the patients will have early onset disease and more severe disease. This disease is first described by George Huntington. Okay, so that's all about the Huntington disease.